Okay, so this week we'll be doing the perception of dentistry in the media. So I wanted to start off with positive portrayals of dentistry, so especially in like books and TV shows. So it's more for like positive portrayals, it's more when the audiences, like adults or like older teenagers or older audiences usually, because they can identify that dentistry is seen as quite a good profession, and they can actually separate the fear from the actual helpfulness of dentistry. So, for example, Hermione Granger's parents in Harry Potter. Harry Potter is a book that's usually for slightly older children. So, her parents are dentists, and that's shown in a positive light in the book. Yeah. And then negative portrayals. There's a lot more negative portrayals of dentistry, usually in the media, because with children, you have that fear of tools and operations, all this kind of stuff. And they just feel so overwhelmed when they go into a dental surgery. And so lots of people have focused on that negative portrayal to sort of open up towards children, to make them sympathize with the movie, like the movie, maybe to get better ratings. But so, for example, in Finding Nemo, there's an aquarium, and that's an aquarium in a dental surgery, and that aquarium is used to bring comfort towards children who might be a bit scared going into their appointment, and it drives like a big contrast between the scary environment of the surgery and the aquarium. And the thing is, right, is that with these negative portrayals, they feed into a child's fear. So maybe a child wouldn't be scared of going to the dentist. Maybe they weren't scared at all. But the way that there's so many negative portrayals of dentistry means that their fear is built up, or maybe it's kindled, and that just makes it so much worse, because that means that they wouldn't want to go to the dentist as often. They wouldn't want their checkups, and overall a decline in oral health. And another example in the 2005 Willy Wonka is that Willy Wonka's dad was quite a strict man who didn't like his son having a lot of chocolates or sweets. And that's sort of spiraled out of control, as you see later on in the movie, and you see that he's opened up a whole chocolate factory. So it could also mean that these portrayals in the media mean that children, instead of taking care of their teeth, they may cater towards more sweets or chocolates or stuff that can ruin your oral health. Now, there's some effects of public perceptions. So a person's perception of dentistry is subjective, depending on what kind of media they've been exposed to. So, for example, if you've grown up, or if you surrounded yourself with watching a lot of horror movies about dentists, where dentists are seen as villains, like in The Little Shop of Horrors, that would build up your fear, and that would mean that you would have more of a negative attitude towards like dentistry and your own oral health. And then that means that also that your own attitude, since it's inside you, that could mean that you end up missing appointments. You booked appointments but you missed them, then therefore you have to book even more. So then that means that other patients may not get a chance to see the dentist as much, and that is overall just a whole negative impact that is because of the media.
So surprisingly, social media actually has a very big impact on dentistry, because dentists can promote their services and encourage communities to care about their oral health by sharing tips and advice that they otherwise may not have known about. It can even enable general dentists to message specialists about suggestions and patient treatment, and just by messaging photographs or radiographs of a patient's teeth, they can get immediate advice before the patient even leaves the surgery. And dentists can also post their own work, and they can make patients feel less intimidated for their visit to the surgery, and it can also encourage people to join the profession. Social media, more than any other medium, can give a dental practice the ability to learn more about their patients and target specific demographics, for example, people within a certain age range, or who are wanting a certain type of filling, or like, for example, gold teeth. And it's also a good way of getting feedback from surveys, where individuals can open up and tell the dentist about how they really feel about going to the surgery. And it can also remind and inform potential patients of some of the positive and negative things about your service and about going to the dentist. And finally, on to politics. Politics in dentistry has, the coming election has shown just how relevant politics is in dentistry. The Labour Party has actually made multiple statements about how they plan to lower NHS dentist waiting times by providing 7,000 new appointments, 700,000, sorry, and they plan to flood the dental deserts with new dentistry graduates for £20,000 for those who spend at least 3 years working in unserved areas. And they also attempt to promote supervised toothbrushing for 3 to 5-year-olds, again about social media, posting tips and advice, and prevent children from being forced to go to hospital, because the major cause for 5 to 9-year-olds going to hospital is for rotting teeth. And the Conservatives, on the other hand, have not addressed this issue by itself, but have instead focused on the overall health of the NHS, and they want to transfer it to an independent NHS board and private healthcare to lower their waiting times, despite this being more expensive and unaffordable. Other parties have also been focused on lowering NHS waiting times as a whole and better working conditions for doctors and dentists. Thank you for listening.